So let's leave the spotlight on Raven's graphic recording as I move into, oh my goodness, I'm so distracted because I just want to look at every bit of this graphic representation. We will make all of this available to you after the summit. Now, while we're looking at Raven's work, I'm going to move into introducing our next speaker. Raven, you're doing a fantastic job. That looks so good. Okay, we are so fortunate to have our next presenter as part of our Thrive team of healers. Dr. Christina Bethell is a professor in the Bloomberg School of Public Health at Johns Hopkins University, where she serves as the founding director of the Child and Adolescent Health Measurement Initiative. And guess what? Dr. Bethell grew up right here in Paradise, California. So Butte County holds a really special place in her heart. And like Laura Porter, Dr. Bethell has spent the last year diving in deep, getting to know our community better so that she can help guide our path to healing. Please join me in giving a very warm welcome to Dr. Christina Bethell.
Here we go, unmuting myself. Thank you for inviting me. So you want me to just go for it? Go ahead and share my screen and start going. Okay, well, everyone who's hanging in there, what a day. Hopefully you're taking care of yourself if you need to take breaks and that kind of thing. I've been with you all morning and have been really nourished by the time that you've put together. So I think one thing I want to say is you really are one of those role models for the country. And it's important that you continue to follow your heart, because I think that's what's really led you to where you are today. I'm going to go ahead and share my slides and begin. And all of this can be available for you afterwards. I don't know if they shared it before, but I sort of put together as many resources as I could. So some of these are just visual cues. I'm not going to be able to go into depth on them, but this talk is particularly oriented, as far as I know, with service professionals and people who are on the front lines working with families, including families who are on the front lines. So I'm going to build on what you've heard about today and hopefully enrich and deepen some of the stories and ideas and resources that you can take away from today, certainly building directly on Junie's talk and Laura's talk as well earlier. So like Danielle said, I grew up in Paradise and was very, very taken by the recent events in the last couple of years that continue. I will say that when I was a child there was also a lot of trauma that I recall. And it's been a long road for this community and the whole Butte County area. So you have a history of surviving, a history of thriving through adversity, and a history of creating the kinds of resources that help somebody like me thrive and really turn my entire life toward supporting that goal in the world. So I just want to recognize where you have come from, or at least from my experience, where I have come from, and the nature of the culture and the people in this area of the world. This is me when I was I think I was either Little Miss Gold Nugget or a runner-up. I can't remember, but I know I sold a lot of tickets for the Feather River Hospital for a cardiac machine, the first one. But at the same time, you'll see this picture of me, and I didn't really smile a lot, but I was very, very adamant to make a difference. And I wrote a poem that was on the cover of the 8th grade poetry book there in Paradise Elementary, or Paradise Middle School before high school. And they put it on there. And I think at this time, if you just glance at this poem, it's not a very happy poem, really. I think I was basically feeling, you know, I had a lot of people around me, but we weren't living in the time we're living in now. We weren't living in a time where we know what we know now. And we know how every moment of care makes such a big difference to not only our hearts, but to our minds and our bodies. And so I think that I was really reaching for some kind of connection, that at that time in Paradise, you had a lot of distance from children. You weren't supposed to be close to them or notice that they were in pain or care for them. And yet now we know that without doing that, we really are withholding the most important medicine that there is, which is our love for one another. And so I often look at this and other pictures of me, and I think, you know, I wasn't smiling. I was very engaged, but I think the difference between a smile and not would have been a little bit more emotional connection and openness, just like Junie was talking about. So wanted to start with that. The other is I came to Butte County by working on a California recommendations roadmap, and Laura's really going to be talking with you a lot more about the different layers of what we know make a difference. But I met Giovanni during this time, and Anna Bauer and your whole team. And all I can say is that you are walking the path of the roadmap that is recommended at the California level, and you have the best help in the country that is available, and any lessons that you have will be, I think, helping so many other people. So you might ask, where are the opportunities for promoting child and family community flourishing, even amid the adversities that we are carrying so profoundly right now? And as you know, they're everywhere, because everything affects our well-being. So whether you're working on the side of, helping create jobs and safe neighborhoods, helping create social connections and community events, helping create beautiful physical environments that are safe to be in, or if you're working directly with families and helping them stay engaged with one another in positive ways, recognize their stress and handle it better, or you're in schools, early care or schools, and also peer groups, YMCA, everybody who's bringing people together, everyone makes such a difference. So it's everywhere, and you're everywhere. So I want to talk a little bit more about this concept of flourishing amid adversity and share some of the research that we had the opportunity to do to, in many ways, prove, I guess, what we already sort of know is true. So it's always great when you get to do research to show what we know is true. But in the world of policy and shifting resources and culture, often that's really required. So here we are with a model that I know Laura has worked with as well, with a leader named Bob Dopplet, and it's drawn from a book called What Doesn't Kill Us. There's a long history of research around resilience amid adversity that we know something about this. And one thing we know is that you may have a certain level of functioning that you start with, and then an adverse event comes, and it's natural for that level of functioning to be disrupted. But if we don't do something, then it stays in a dysregulated state. And when we stay in dysregulation, all the things that go with dysregulation, especially disconnection from ourselves, our bodies, and each other, where we can access the resources that may be there and that build new resources, get cut off in many ways. So you're not doing that. At the very least, you're in recovery. And recovery is an important stage to honor and recognize when we are suffering. And one of the biggest responses to trauma is to freeze and to not even know that you're suffering, because our bodies are made in miraculous ways to cut us off from pain that we can't deal with so that we can survive. So when we're in survival mode, after we have suffered a trauma, we can get stuck in recovery to maintain and survive and not do what's actually always possible, which is to grow. And so growth at the community level is something you're very actively engaged in. And of course, it really depends on each individual as well. So when you're growing, you're doing something called transformational resilience. And this is the term that is used in Bob's platform. And moving beyond the levels of functioning that you had before, and seeing this as an opportunity to catapult your own well-being as a community, as a family, as an individual, by meeting the pain of the trauma in ways that allow that growth to occur. But this requires a conscious choice. It's not something that will just happen. It turns out that our intention, waking up every day and intending for that, even if you're not feeling it deeply because of extra stress you might be having, really will continue the suffering. So to make the choice every day to wake up and say, I'm going to grow through this, I'm going to do the things that I know I'm able to do every day to grow, including reaching out and staying connected with others, which is the most important. So we have a lot of research on flourishing and how to promote it. And in today's world, advancing, especially youth flourishing, is always about promoting flourishing amid adversity. So I say that flourishing, and I want to define it a little bit because there's a research and I just really want to synthesize it down to the 6 attributes of flourishing that we know about. And all of them come about or are harmed or facilitated by the quality of our relationships. So I'm just going to ask you as I go through this to reflect on where you might be today and ask the question, can we flourish during difficult times? Is it a question that resonates with you? What's your instinctive answer about that? And these are some of the qualities. So the first is having a sense of meaning and purpose, which has been shown to extend life by at least 8 years. Just having that. And how do we get that? Being engaged in daily life, meeting what is, and getting up and being engaged with what is. Valuing positive relationships and doing things to foster them. You don't always have the blessing of positive relationships throughout your life, but if you can stay valuing them and striving for them, then that is sort of a way of flourishing in a living and relating way. Curating positive emotions, recognizing that in the midst of difficulty, there's always something that isn't difficult. And it's a cruel and unfair truth. But, you know, in many ways, they're curing chronic pain in the body by asking people to go to the part of the body that doesn't hurt and really immerse themselves in that part that doesn't hurt. And then come back to the part that does hurt and see if it's changed a little bit. And through that process of bringing the part that's not hurting to the part that is, even within our own bodies, we lessen the pain and we can rewire to bring at least the resources that we do have. So curating, looking for the good, not ignoring the bad, but looking also in a dual continuum way, parallel with, is very important quality. And it's a skill that I know many people, including me, did not get taught. Having a sense of accomplishment, which really is, for many people, just being your best self. This doesn't have to be any grand thing at all. Really being present is a huge accomplishment. But having that sense, feeling it for yourself, that you know that you matter. And this is the last one, a sense of mattering. And a sense of mattering is not something we give to ourselves. We actually know that we matter culturally, contextually, by whether people recognize us, rely on us for something, recognize something we do bring to their lives, and that we are seen literally, physically, that somebody actually looks at you. And without being looked at and without being seen as someone who has something to offer, calling people up to that offering, we walk around without a sense of mattering, which is actually an epidemic among youth when we interview them these days, and even before the COVID-19 pandemic. So the questions you might ask is, or the things you might say are true for you if you had this, is I experience a sense of meaning and I find my own purpose. I value life and participate each day to nurture my own life and that of others. I believe in, learn about, and act to create positive relationships for myself and others. I notice and search for the good. I curate and absorb positive emotions. I experience a sense of accomplishment in how I contribute to others and life in a positive way. And I experience a sense that I matter to myself, to others, to life, and our society. So now we're going to do a little poll just to see where you feel you're at right now. And like Junie said, we're not going to do anything with this information. It's really just to get a sense of where people are at today. So all I want to point out is that probably many of you are noticing when you reflected on it that in many ways you might even be flourishing more now than before because you're more engaged, more of a sense that you definitely matter, and that you're learning and growing and being challenged, but it might be giving you a sense of accomplishment and you're having to learn about relationships because we really need each other. So at least it's an opportunity, and to know that really does help. And it helps us actually turn toward what's hard and use it as a source of growth. So I want to turn some attention right now to the frontline workers and those of you who are really helping directly with parents, and try to get a little baseline on where we're at now. I ran some data and actually wrote a little blog for this session today about how are families doing in America using the most recent National Survey of Children's Health, which our center sort of helps create and disseminate across the country. So first of all, about 1 in 3 children today have moms who are not coping very well. And you can imagine with the COVID-19 pandemic, that might be going up. But what's really connected to this is a sense of hope and a sense that I have strengths to draw on. So if 2 in 5 children today have caregivers that say they lack a sense of hope and the ability to see that they have strengths to draw on when things are hard, they feel somewhat hopeless. And in those cases, those parents are 3 times more likely to report that they often feel anger and aggravation toward their child. So it's normal to feel challenged as a parent, but when that body sense of anger and aggravation come up, it can often be because the parent comes from their own history of trauma, making it harder, or they're not reaching out because they don't feel like they have hope. So activating hope and a sense of strength and actively focusing on how to develop that moment by moment is a critical attribute of building parenting well-being, like Laura talked about, that we're really counting on parents and families. So they need all our support. And of course, all of us are those parents. Got it. Okay, so we have about 58% saying they experience most of these qualities and 20 all. So that's 78%. And for those who have a few of these aspects of flourishing, it is my deepest hope that this will be nourishing for you today in ways that will build on your flourishing, and to make sure that you reach out for support. And so we can talk more about that in a minute, what that looks like. So I'm going to address that specifically. So I wanted to make sure you knew this sort of relationship between coping, having hope and strength, sense of strength, and feeling that sense of anger and aggravation, which can often lead to withdrawal as a parent or to aggressive behavior through words and other ways. So it's really important. And that we have about 1 in 4 moms who already experience poor mental health, and that this is really how we help children, is to help their family members. So this is the little blog that I sent along that you can access. So our research has tried to define this. So we know this in general. What is it that we're talking about? What is family resilience? Well, it turns out it's talking about things together, working together to identify opportunities and solutions, staying hopeful, and identifying strengths. That leads to and helps facilitate and foster parent-child emotional connection, which we know is the core of healthy flourishing and resilience amid adversity, and helping parents cope with the demands of parenting during this time, and reaching out is our work. So just to give you a little bit more of how this is a population piece, and again, this isn't something I'm expecting you to all read carefully, but what we found is about 21% of children, all children, whether they had ACEs or not, who did not have families who practice these aspects of resilience, were flourishing. And about 51%, over 30, exactly 30% more when the families had these qualities. And you might say, well, these families are different from each other.
Maya or Dixie, Tasha?
I think we have a person who needs to be muted. Okay. So we looked at this according to ACEs levels. And what you can see is that it is true that many children are not flourishing right now in society, which is really just that they're showing curiosity and engagement in school, being able to persist and not give up easily in fulfilling tasks that they choose to do, and can stay in control of their emotions and behavior when faced with normal daily challenges. And so we have a bigger issue to up-level our level of flourishing for children and for ourselves. And this is certainly an opportunity for us to do that during this time, if we look at it that way. But mostly what I want to say is that by building these qualities of family resilience and parent-child connection, our research showed that nationally, children, even with 4 to 9 ACEs, can flourish. But more importantly, if those with no ACEs, no adverse childhood experiences at all, do not have families that do this, they're not flourishing. So this is really important to make sure that we recognize this is relevant for all children, and that if we look at positive qualities of health and they're absent, we know we need to take action, whether ACEs are there or not. And because that can often be what leads to those adverse experiences over time in families. So the next thing I want to introduce from our research was really, you've heard people talk about positive childhood experiences. And we actually were curious about that a number of years ago. What about, there's adverse childhood experiences, what about positive childhood experiences? Do they operate in a cumulative impact way, just like ACEs do? So had the opportunity to include some data points in a statewide survey, and we're able to look at it empirically with analysis, and found out that adults with fewer positive experiences were almost 4 times more likely to experience depression as an adult. And those that had positive experiences were 3.5 times more likely to have the social and emotional support they needed as adults, which is critical to health if you look at the literature. But what's really important is that this was something that held up regardless of the level of adverse childhood experiences. So those with high adverse childhood experiences, just like I said before, if they also had more of those positive experiences, they were much less likely to be depressed as an adult. So just like has been said all day, this is one piece of research that really has shown that, and there's a lot more detail to it, but these were the positive experiences. Being able to talk about feelings, feeling that your family stood by you in difficult times, that we don't just ignore it and say we'll get over it, but that we really recognize the difficulty and connect around it. Enjoyed participating in community traditions, which we really can work to do during this time. Felt a sense of belonging in high school. For me, these 3 and 4 were really big, and Paradise was really good at traditions and special events and the high school. And that's what got me by, because I didn't have it otherwise. And so we have such an impact at the community and school level. And this is very clear in the data. Feeling supported by friends in small ways and big ways. The small ways often matter the most. And having at least 2 non-parent adults who take genuine interest in them. So the last is feeling safe and protected by at least 1 adult in the home. Children that don't experience that really have a dire need to be supported. And for those of you working in child welfare, that is a lot of the work that you do. So, but going back to the first study, what we showed, again, I just want to emphasize this one more time, that even though we have found that we have a long way to go to promote child flourishing in the United States, with or without a pandemic, that when we build family resilience and parent-child emotional connection about things that matter, talking about things that matter, which is usually something hard. So we take what's hard, share about it in a safe way, and it turns it into a positive experience. That is the most positive experience. So when that happens, those children are about 4.6 times more likely to be able to stay calm and in control when faced with a challenge. And when you back the data up even more, it's really the resilience and sense of hope and sense of strength and coping of the family that allows them to connect with the child this way, that allows the child to flourish. So it's a direct line connection from the research. It's also supported by the science, and it's something that you all are implementing actively today. So it's very exciting. And I did want to recognize someone, Lindsay Bramman. I haven't met her yet, but I want to meet her. She took our research and turned it into a COVID kids activity book. So I want to say hi, Lindsay, if you're there. But yeah. So, but one of the special pieces in the book, if those of you are if you have it, is to really create a family resilience plan. And someone talked about Brene Brown before. I think it was Junie Yu talked about her. She actually talks a lot about having a family resilience plan where you really get honest about what does a bad day look like? How will other people know when I'm having one? How do I even know? Often we're so disconnected from ourselves. And be able to connect with each other and know what to do and have a plan and lots of ideas for how you can deal with that. So creating a family resilience plan is important for yourselves, obviously, but helping families use this workbook, I think, would really be very supportive of them at this time. So to summarize, the main points I want to get across is that we can have more or less adverse experiences, and we can have more or fewer positive experiences. And based on that, we are either less well or more well. You can have a lot of ACEs and be less well. And you can also, because you have low levels of positive experiences. And you can have a lot of ACEs and be better because of them. Obviously, we need to continue to do all the work to reduce ACEs, but the theory I have running is that we're going to do that by promoting the positive and the skills, and then that will factor into the reduction. So this isn't being, airy-fairy and saying, oh, just forget the ACEs. This is a strategy for addressing it, is building those skills. And again, remembering that kids with high adversity but high relational health can fare relatively well. And those that do not have high adversity but does not mean that you're broken or doomed. And that the biggest positive experience is talking about things when they're hard and being supported and cared about. So that gets back down to the emotional vulnerability issues and the ability to do that. And then the other big point, you don't have to go through all this, but those of you who want to see it, is those with low adversity may still not be doing well because they lack these positive relational experiences. So to not avoid that, because that can be a large portion of children, especially among families whose cultures are to disconnect from the emotions. And that is actually a big cultural issue that I think we're up-leveling right now in our society, is bringing out more of what's in us. Okay, so I'm going to do a quick flash on some resources, and then I'm going to end by talking more about your well-being and how that might be fostered. So one resource is recognizing the reality of what we call biosynchrony, and that's a formal scientific word for what's kind of happening when we're doing attachment, when we're attaching to each other emotionally, and when children and parents are attaching. It's literally a physiologic connection that you can feel and learn to sense in your body. And so even you as providers can cultivate this capacity for sensing whether I'm connected and whether I'm seen as being connected. So this process of, I connect with you and I can see that you see that I'm connected to you, meaning you're taking it in. And then it goes back and forth. This serve and return capacity that is so critical to parent-child attachment is also at play in our daily lives. And that it's a literal physiologic piece that obviously is very, very guided by the heart and the emotions experienced, but it's a felt sense in the body. And so learning this skill ourselves when we work with families is really critical, but teaching families that they have this innately, and it's what we often long for the most. And when we don't have it, there's always an agitation. And it can just be that we're literally not receiving that interconnectedness that we are built for. So to have this, you kind of have to be able to come out of being stuck on or stuck on off in trauma and start to come back into your body, to be able to sense it, to be able to reach out in a trusting way or be received or let somebody reach you if you're not feeling well. And so I'm not going to go through this, but this is a very important exercise of starting to unpack the different things that are happening every second. We're seeing things with our senses. We're hearing things. We're having emotions, always. They don't ever go away. Thinking, we're always having thoughts. And we have instincts based on the patterns we've learned. And so in the mindfulness practice here, which you can also just think of as a practice to be able to really connect with yourself and others, we have to kind of be aware, what am I seeing and hearing? What are the feelings I have? What are the thoughts I have? What's my reaction? And now what do I choose? And so staying in that place of being able to respond versus just react is really critical. And this practice is very important to help families with and ourselves, and to make it so it becomes a habit. So it's not really something you have to sit down and think about all the time, but you just do. And the best practice I know of for families is the RAIN, or for moms is the RAIN practice, because it's really simple. It's an acronym. And the blog that I sent you all was, when it pours for moms, help them reign. And the first is to be able to recognize what's happening. And usually you can always find it in your body, even if it's not in your mind. So if you're staying in touch with your body, you notice, oh, my breathing is more shallow, or it's more deep, or I'm feeling something somewhere. You can always find it somewhere in your body. And just being able to attune to that and allow it to open the space of curiosity. And then things start to shift, because feelings always move. They're definitely in motion. Emotions are always in motion. And accepting that what is there, along with many other things, and allowing it. Just not going into the pushing down. And then investigating, being curious, opening up to what arises in your mind that maybe adds to your understanding. But really, it's not to fix. It's mostly just to see what is becoming available with a curious, gentle attention. And it may also be more information about what's really going on. What do I really need? What do I want? And maybe helps me realize, oh, I need to take a break, or I need to reach out, or I need to get some support, or something like that. And then to nurture with loving presence, to recognize that our presence is very nurturing, that biosynchrony place. If we're in it, some of us may even feel it right now, in the quietness, and there is something in that quietness called presence. and it is a force for healing that we understand even biologically. And so to abide with what's hard, just like we said before, talking about what's hard with your child brings healing, brings the positive experience. It can be counterintuitive, but once you get the feeling of it in your body, it's something that you just ride like a bike. And I think that's really the opportunity of this time, is to relearn what we're built for, that we're built for this life, and that there's something organic in our being that understands this. Another resource I wanted to invite you to consider is, it's free for families in English and Spanish, but it's a way for them to start to engage in self-reflection about how things are going for them right now. And it also helps them start to want to reach out to start getting their well visits. I hate to jump to that from what I just went to, but really there are services available and they're not being used right now. Families aren't necessarily coming in for the support that they really need right now. And so this is an online tool that is made for families to help them reflect on their needs and share that with their care providers, anybody in their world, to be able to start to have those kind of conversations and get the support they need, and also make sure that we're not missing a lot of developmental assessments and parental depression assessments and things like that during this time, which is happening. So I can share more about this, but I know that we've used it, we've actually created and studied it and that kind of thing, and it's available to people to use. It's guideline based and a way to get families to start coming in, and whether you're an early care provider or a parent or a social worker or healthcare worker, it's a really important tool. And what families get is, it just takes them a few minutes to complete it, but all the priorities are around the guidelines. So the importance of having someone to turn to, it educates families also about what's normal to want and expect. And then they get a guide that basically says, oh, this is a mirror of how we're doing right now. And then to share that with whoever they want. So it's theirs and they can share it with whoever they want. And it can be shared with pediatricians to get all off the table, all those screens, so that you can really spend the time with them around what's come up. So I think it's a tool to consider. And then the other is, I put this in the reading packet, recommendations from the National Child Traumatic Stress Network on how service providers in health, education, and social work and others can start working with each other at the community level. And Laura named a number of strategies that are being discussed at a policy level. And these are complementary to that. So I'm just going to go ahead and add to that, which is family awareness campaigns, which is frankly what this is, right? This forum, but to continue to really invest in that. Again, improved identification and reporting so that you have a way of getting information. And that Well Visit Planner tool is at least one way to, at the family level, be able to keep going with the early identification during this time and not getting too lost in not knowing about that. Creating text chat messaging for social media so that distressed youth and families that may not feel safe otherwise to come in because of COVID, or who don't feel safe in their homes, have a way to connect if you don't already have this. Visiting children and adolescents that we know as much as we can. And I know that's going into the homes is hard, but some way of staying connected proactively, which is probably all of what's happening already. And then taking prompt action to relocate. And I don't know where your community is with this. I know Laura was talking about it, but there's a lot of different strategies that are being thought about on how we can continue to support families in this time, keeping families together, but also addressing the difficulties. And then afterwards, and even now, starting to set up enduring psychological first aid programs in schools and in all centers that work with youth and families, to really especially train around elements of psychoeducation and emotional regulation, a lot of what is the focus of today and so on. And that just to make that an enduring investment, and that will be one of the benefits of this time. So that's just a quick flash, some resources I wanted to make sure you had. And I have others as well at the end, but I'm not going to go through them. I'm just going to leave them there for you and you can look at them. So I wanted to just close by talking about your being. And we started with this, asking about your flourishing. And about 78% of you felt like you had either most felt like they had most, but not all. And again, to continue to make sure that space is made for you to prioritize that. Not only because that's a good thing for you, But like I said, how you are present with you really can be felt by the body of another person, by the mind of another person, by the heart of another person, and in a very direct biological way. And so we can't really fake it, you know? And so it's important that we find ways to stay connected and vulnerable to our own experience. I love this picture. I don't know if it moves you, but when I look at it, it brings something up in me. And I wonder what it brings up for you, if anything. But probably something along the lines of the importance of that biosynchrony. And all the times in the day, wherever we are, that we have the opportunity to titrate back into that sense of connection as a resource, is the most important resource. And again, knowing that everything we do, every interaction creates a reaction. So you have so much to do if you're in health, education, or social work. I mean, there are all these things. I'm just putting this up here, and we have to make sure we don't re-traumatize. And what does that mean? Really learning about, this is new learning. It's new learning for all of us. And even if we learn it once, we have to relearn it because we're always changing. But how do we change mental health care so that people don't just feel like 10 people are asking them about ACEs, but no one's really listening? They're treated like a number. You know, all kinds of ways that we know if we've been providing healthcare or social services or educational services, how they're not yet trauma informed at the systems level. And to continue to be aware of that and be an advocate for that within the system, and then show up in the relationships in a way that we've been talking about today. So that's a lot right there. And then you have to learn about all the different ways trauma can show up so that you know what to do. It's very different if you're dealing with somebody who is having an active fight, flight, freeze, or fawn. If you don't know what that is, that's sort of turning toward the threat in a way that tries to align with it so it will stop threatening you. And even on top of that, there's subtleties like how freeze and shutdown are different. Those sound the same. There's a lot to learn. And there's important resources that I can share with you and will share with you about how to understand the subtleties of this so that you can recognize where somebody is. Are they in freeze or are they in shutdown? And there's different ways you would approach with your own being depending on that. So that's a lot already to know. And to not really buy it when people say they're fine, because fine usually isn't fine, especially among younger people. That takes a lot from you. So what's important is that you cultivate your own sense of well-being. And we know that one of the keys to the lack of well-being among service providers is in creating burnout is a loss of compassion and running into a place called moral hazard, where you feel like you're not sure you're hurting more than helping. You're feeling burnt out and not sure you can show up the way you want. And often the way to break that is by building incredible amount of compassion first for yourself. So there's space, just like that RAIN practice, for your own experience. And just doing that allows you to reconnect with your own self. Because if you're not connected to yourself and your own experience, you leave yourself out of the compassion equation. You will not ever be able to really sustain that with others, even if you truly want to. So it's very important. There's a book called Compassionomics that brings all the research together that really makes it very evidence-based. The importance of compassion and the role of lack of compassion for yourself and the ability to extend that on your own physiology. This is just a little graph that shows what's happening in the body of a caregiver or a healthcare worker or a social worker when you are not able to stay in that place of compassion for yourself and others. And then the incredible power of it, that a message of empathy and kindness that endures, to not be afraid to hold that space of care, even in a silence, especially when you touch into that biosynchrony of real contact and care. It has a magic and you can feel it. And to really understand that so that it's motivating, hopefully, to cultivate it. That it comes from you. I always say the water faucet feels the water coming out. The one who's feeling the compassion feels it themselves. It's a sense of nourishment for yourself. And so really deepening more than just, oh, it's important that I take care of myself, the literalness of the importance of this level of well-being, where you're actually settling into a place of self-care and self-love and a sense of compassion that's maintained, which isn't going into overcare, I got to fix it, or undercare. It's just staying in that place of care for whatever's arising, that really allows people to stay with compassion. When we try to fix it, eventually we burn out and then we disconnect. And then when we disconnect, we feel bad. And so we go back and forth between overcare and undercare versus that place of care where compassion really lives. And if you're a teacher, the research is very clear that your closeness with the child in ways that are safe for that child is just like those positive childhood experiences, cutting very much into the risks that they have. And so I'm partly trying to bring some research resources to you for those of you who want to learn more, and I can follow up with you about, and this is all just in the last couple of years, by the way, these pieces of research are coming out. This was November of 2019, and ours came out in September of 2019. It was like the world knew something was going to happen, and all these studies started coming out that are basically giving us permission really to do what we know, the importance of teacher-child closeness. But the importance of that teacher-child closeness being dependent on the well-being of the teacher. So there's a packet of research for teachers as well. And what do we mean by a healing relationship? So I am not going to talk about this, but I want to say that there are resources for you to think about and have discussions, if you want, of what makes up a healing relationship. And certainly really actually valuing and appreciating that power balance and those implicit biases is very important, and so on. And that abiding is holding that space of positive contact and really being there. And the competencies really come back to that attunement, to the being, your being and that of your clients, connecting to a sense of alignment, that biosynchrony, creating a sense of belonging at the 2x2 level, at the family level, at the community level, noticing and identifying possibilities, what I call finding the jewel, and running small experiments. And I'm going to end with that finding the jewel exercise in a second. To go from fixing to connecting, just another little process to connect, notice, and allow. And if you think about connecting with somebody when you're even in an emergency situation, we still want to approach with attention and allow the connection to go slow as it needs to go for it to stay authentic and stay in that biosynchrony space, to really notice the subtle and not look for big things, but stay in the subtle noticing. That's where we feel seen, is in the moment. So that mattering piece I talked about, you get that when you're seen in the moment that you are, not seen retrospectively so much. Oh, you did a good job on that test. It's more being seen in the moment really is very powerful. And then staying with that, and then allowing to come what comes. It's very much like the RAIN exercise, but more applied to an interaction. So it's just another way to talk about the same process, that when you move into it, and for those of you who do this work, you probably already know this, it's like a dance and you know when you're there. It's like you know when you're connected versus not. And that it does have a anatomy, it does have a skill set, and those can be learned. So we all have roses, things that are going well, the thorns, things that are challenging us, and these buds are the things that we really haven't quite given birth to, but we know we can. And being aware of that and where you are flourishing, hopefully will support you in that going forward. So the second poll is really just to tap in, and this is really for the North Valley Community Foundation and the community to find out, where are you at this point? This is not something your name's attached to, but it'd be awfully good just to have an authentic sharing among the people who are on the front lines. How are you doing? And I know this is phrased, how confident do you feel as you work with children, youth, and families carrying trauma? But it's the other way of saying this is, how are you doing? And do you have what you need? So let's just take a second and see how this poll goes. This is very, very good to see where people are at, and to find one another in this, and to also recognize that most of us right now really are very committed. We're flourishing in that way. We feel like we have meaning, we're engaged in life, we value relationships, we're trying, but it's hard. And so again, like every other speaker, the source of our support comes from one another, and being willing to to look inside and stay connected on the outside. So this is very helpful to me, and I hope to everybody who's in a position to support the people on the front lines, whether you're social work, education, healthcare, community workers, police, firefighters, parents, of course. So I think we can stop that one right here and open it up to, everyone saw the results, and open it up to some questions. Not sure exactly how to close this. I guess I do it this way. Just letting you know that I do have a little tiny video that could delight you if you want me to show it. It's 1 minute long, 1.5 minutes long, or we can just go into questions. And then after this, there are a lot of resources for parents that I've actually sent for them to be online, like tip sheets and things. So you don't have to make it all up, but there's a lot out there, you know, parent support groups, things for you, resources. So we can go over some of those. I can also show this little video if you want to have a little upbeat end, or we can ask questions. What would you like me to do, Danielle?
So let's go ahead and show the video. And then what I want to announce to everyone is that Christy's actually agreed to stay on for an informal brown bag lunch session. So in a moment after the video, what we'll do is have you grab your lunch or your snacks, whatever it is that you have for your lunch break, and come back and join us. We'll have some time for questions and answers, and just an informal networking time to hear more from Dr. Bethell. And I did want to say, Christy, I hope you saw it. Lindsay is on with us. She put it in the chat. So thank you.
No,
Lindsay.
I didn't. I was so laser focused, but I'll have to meet her.
Okay. Yeah. So thank you, Lindsay, for the materials. They're fantastic. And I also wanted to let everyone know that tonight, Dr. Bethell is going to provide a special session from 6 to 7 p.m. for parents and caregivers. So it's not too late if you want to encourage parents and caregivers that you work with to join in for that session. We'd be happy to put the link in the chat, and you can get that out to the folks you serve.
And I promise I'm not going to flash up research studies or anything or policy discussions.
Okay. Such great resources. So here's our plan. We're going to show the video. We'll take a break for you all to grab your food and come back and join us for the lunchtime session. At 12:25, Kelvin Mockingbird is going to provide another musical performance for us, and then we'll pick up with our afternoon session with a raffle drawing and our next presentation. Let's go ahead and show your video.
Good. And this is just the power we have every day to stay at the watch of the meanings we make as our own brains and those of our children grow. And it's a beautiful little set of songs that these children sang about what they've been learning about how they learn. You can see it now? Okay.
Reading a story, and my brain says, hey, this story reminds me of another day. It's all the connection from text to sound. This story reminds me I've done it myself. I'm reading the story, and my brain is full. This story reminds me of yonder day. It's all of the from text to
So I think, let me make sure I get out of this so you don't end up hearing about football apart there. Really just to say, you know, we're all making meaning and connecting. The more we can be conscious of that, more we can redirect it to what's possible. So, and not to forget about the kids. And they're doing that too right now. So,
Well, thank you
okay,
so much.
ahead.
And I just want to say thank you for just diving in deep with our community. And we look forward to continuing down this path of learning and growing side by side with you. And you're such a tremendous resource to all of us. So thank you so much, Dr. Bethell.